Hello friends, welcome back. In this session we are going to discuss about one of the important deliriant poisons in toxicology, that is the Datura Fastuosa. Myself Dr. M. Srinivasan from Chettinad Hospital and Research Institute, Chennai. Deliriant drugs act on the brain and induce delirium, that is altered state of consciousness with agitation, confusion, disorientation, delusions and hallucinations. Due to delusions and hallucinations, with agitated and confused state of mind, a patient may go for either suicide or he may assault the neighbors, or sometimes even murder also can happen. Examples for delirium drugs include Datura fastosa. This is the fruit of Datura fastosa, which is spherical shape with a soft and sharp spines all over. But this Datura fruit often resembles the fruits of this castor plant, that is Ricinus communis. But this fruit is usually single, and it is relatively larger compared to the size of the fruits of this castor plant. Those fruits are smaller and they are born in clusters, like a bunch of grapes like that. But those fruits also usually greenish or greenish purple in color, with spines all over, but they are smaller and born in clusters. This is the Atropa belladonna plant, also called a deadly nightshade, Hyoscyamus niger. This is the cannabis. You can see the leaves are 7 here. Sometimes it may be 9 also, but always the number of leaves in cannabis is in odd number. This is the another drug of abuse like cannabis as a cocaine powder, right? So these are the common deliriant drugs, of which datura, cannabis and cocaine are important for the exam purpose. This is the memory aid to remember this example for deliriant poisons. D for datura, D for deliriant, at least one poison I can remember. This datura is one of the most common poison, especially in the rural side, used for commission of suicide. So knowledge about these clinical features and the treatment is important as a doctor, right? This Datura fastosa is popularly called as roadside poison or simply road poison or railway poison, etc. Because it is often used as a stupefying agent, and these powdered datura seeds or this decoction from the seeds are being mixed with the food substances like chapatis, curry, or drinks like coffee or alcohol, and sometimes it can be mixed with tobacco leaves and being given as a cigarette also. So whoever after consuming these drugs or smoking that cigarette, due to effect of datura, they go for a state of delirium and eventually become unconscious. That will facilitate the that friendly stranger to rob the valuables or kidnap the victims. There are different species of datura. This is the datura stramonium with a woody stalk, pointed leaves. This fruit which is somehow elongated compared to datura fastosa fruit, right? This you can see instead of typical spherical, somehow it is elongated, right? With bell-shaped or trumpet-shaped flowers. That is why it is called a angel's trumpet or hell's bell, etc. This is the seeds of this datura stramonium, often called appear as dark brown or somehow blackish colored seeds with numerous depressions on the surface. The word datura originates from the Sanskrit word durta, which means cheat, as it is used as a stupefying drug. Other species are Datura fastosa, also called Datura metal. It is not metal, often the students write METAL, the spelling is METEL, right? Datura discolored, Datura ceratocola, etc. Of which Datura fastosa is very important for exam purpose. Synonyms for Datura stramonium are thorn apple, Jimson's weed. Actually, it is a Jamestown weed, because the first case of accidental poisoning with Datura toxicity is reported in the town called Jamestown in the state of Virginia in US in the 1676. It was later became modified as Jimson's weed, right? Devil's weed, angel's trumpet, hell's bell, etc. because of the shape of the flowers. This Datura fastuosa plant usually grows up to 3 to 5 feet, and you can see a woody stalk like this with a, instead of borne in cluster, they are seen separately, right, individually. It's a typical spherical shaped fruit with soft and sharp spines and the pointed leaves. And these are the flowers of the Datura plant, which is typically bell shaped or temple shaped. And this is a nocturnal plant, and these flowers blossom during the late evening hours, right, and emitting a nice pleasant scent all around. All parts of the plant are poisonous, including the stem, root, leaves, fruits, of which the seeds inside the fruit are poisonous. Even the flowers also poisonous. So it belongs to the family Solanaceae. There are two varieties of Datura fastuosa based on the color of the flowers. The plant is having this typical dark purple colored flowers or somehow blackish white or black tinged white color flowers. This is the Datura Niger variety, right? Whereas Datura alba variety is having a pure white colored bell shaped flowers. So these first two are Datura Niger, this is the Datura alba. Either of these can be kept in the exam as spotters for you. This is the fruit of Datura fastuosa. Inside the fruit, around 400 to 500 seeds are there. The fatal dose of Datura seeds is around 100 to 125 seeds. So, with 500 seeds, you can kill around 4 people, adult people, right? So, even one fruit is sufficient to kill 4 people. So, that much toxic this plant is. This is the seeds of this Datura fastuosa. It is either yellowish brown in color, but you can see a numerous depressions on the surface with kidney-shaped seeds. So seeds are the most toxic part, as the toxic alkaloids are more concentrated in the seeds, though all parts of the plant are poisonous. Traditionally, this datura and the preparations were used in the folk medicines. In the China, it is used to treat asthma, COPD conditions, etc. It is used in the form of cigarette. This datura leaves or this seed extract or seed powder, they are being in many quantities, they are smoked, which is having the antihistaminic properties and the bronchodilator properties, help to relieve the asthmatic conditions. In India, it is used in ritual prayers and as an aphrodisiac also. Aphrodisiac means those agents which increase the sexual desire in the person or increase the libido. Can you answer this MCQ? Can you pause the video and try to answer, right? Solanaceae is the family name of, that is answer is B here, right? Datura fastuosa. Color of flowers in Datura Niger is, so it should be either purple or blackish white in color, right? So answer is C. Whereas white flower is Datura alba. So what is this plant on the left side? This is the somehow blackish white, right? There is Datura Niger. On the right side is the Datura alba with pure white flowers. Coming to toxic alkaloids or active principles present in the plant, one of the main active principles is the hyoscine, also called as scopolamine, which is mainly present in the fruits part of the plant. This hyoscine in the medicine, in the pharmacology, it was read, right? This hyoscine is used as an antispasmodic to relieve the cramps, GI cramps, etc. As well as it is used as a drug to relieve the motion sickness also. This scopolamine is one of the drugs being used as the truth serum. That is the drug used to extract truth in the lie detection test or narco analysis. This is the hyoscine, also called scopolamine, which is present in the roots and the seeds part. This also similar to hyoscine is as an antispasmodic drug, right? This atropine in the medical uses, you know very well, this atropine has a variety of uses. This is atropine sulfate injection. The vial, it contains 1 milligram per ml, whereas the ampoule form generally contains 0.6 milligram of atropine per ml. These are the main toxic or active principles present in the Datura plant, and these together are called belladonna alkaloids. The movie, Tamil movie called Kurdi Punal, hero used these tooth serum drugs to extract tooth, this tooth from the uh, victim, right? Or this alleged criminal. He injects these tooth serum drugs and try to take the confession. So these are the different uses of atropine, like it is used to treat bradycardia and vagal syncope, as it is the anticholinergic drug, as a pre-anesthetic medication to dry up the salivary and bronchial secretions. Antidote for OP poisoning, it is one of the first line antidote. Treatment of iridocyclitis, as well as for getting the pupillary dilatation, facilitating the refractory procedures by the ophthalmologist. Hyoscine, that is scopolamine, it is used as an antispasmodic. This used as a motion sickness also, as pre-anesthetic medication, etc. Whereas hyoscine is used in the treatment of Zollinger-Ellison syndrome, and similar uses like atropine and hyoscine also. So this scopolamine is one of the drugs being used as the tooth serum, others being this ametal sodium, flunitrazepam, thiopental sodium, etc. Following is not present in Datura: hyoscine, hyoscyamin, muscarine, atropine. So these major alkaloids we have discussed is hyoscine or scopolamine, hyoscyamin, and atropine. So answer is C here, muscarine. Coming to mechanism of action, these belladonna alkaloids, they go and bind with the muscarinic receptors in the central nervous system as well as the peripheral nervous system, thereby blocking the action of excitatory neurotransmitter acetylcholine there. So it acts as the muscarinic receptor antagonist, resulting in parasympatholytic or sympathomimetic or anticholinergic toxicity. These clinical features, if you remember these OP poisoning clinical features, which is due to cholinergic toxicity, that is why the atropine is being used. This atropine, these alkaloids produce exactly opposite clinical features than that of this OP poisoning. There will be increased secretions and increased excretion. Here it is a drying up of secretions, and excretion also is blocked here. So these alkaloids have both the central and the peripheral action. The central action, there will be initial stimulation of CNS with the resultant excitement and restlessness in the patient, and subsequently he go for depression of CNS with delirium and coma. Peripheral action, due to blockade of peripheral muscarinic receptors, including these exocrine glands, smooth muscle, and cardiac tissue, they produce anticholinergic effect there with parasympathetic paralysis. So OP poisoning, there will be spasm of smooth muscles, stimulation of exocrine glands with increased salivation, all these. Here it is all drying up of secretions and salivations, uh, smooth muscle relaxations, all these will be here. Appearance of symptoms occur within few seconds if the alkaloids that are ingested, right? Toxic alkaloids are taken within few seconds, clinical features start, whereas the decoction of seeds relatively slower with less than 5 minutes, whereas ingestion of seeds, the seeds are consumed, then it will symptoms may be delayed up to 30 minutes. So fastest is that alkaloids like atropine are directly taken. These clinical features secondary to this Datura toxicity can be remembered by this phrase: mad as a hatter, blind as a bat, red as a beet, hot as a hair, dry as a bone, because of the anticholinergic toxidrome. We will see what are these actually meaning. Coming to Clinical features of this Datura poisoning due to anticholinergic dog syndrome. We can remember these clinical features starting with the various number of Ds, right? Similar to the OP poisoning, for remembering the muscarinic effects with a sludge or dumbbells mnemonic. Here, D for Datura, D for these clinical features starting with the Ds, right? Due to inhibition of these salivary glands, due to these belladonna alkaloids, there will be dryness of mouth, bitter taste, as the seeds are bitter in taste, leading to nausea and vomiting. Then, due to dryness of the throat, there will be difficulty in swallowing, also resulting in dysphagia. Then dysarthria, that is a difficulty in speech, right, due to dryness of the tongue and mouth, and resulting due to inhibition of salivation here. So dryness of mouth, dysphagia, dysarthria, all due to inhibition of these salivations. Coming to eyes, there are dilatation of both pupils, right? Mydriasis will be there, which is sluggishly reacting to light initially. Later, there is no reaction to light. So, bilateral dilated pupils due to blockade of this papillary sphincter muscles as well as iris muscles, conjunctival congestion resulting in bloodshot eyes. Due to mydriasis, there will be double vision or diplopia, photophobia, temporary blindness due to loss of accommodation for near vision, right? So dilatation of pupil and diplopia and photophobia are important here. Then coming down, there will be dry hot skin due to inhibition of sweat as well as stimulation of heat regulatory center by the belladonna alkaloids. So dry and hot skin, right? Due to inhibition of sweating and cutaneous vasodilatation, there will be hot skin also, resulting in slight increase of body temperature even up to 105 to 107 degree Fahrenheit, and dermatitis in the case of highly sensitive persons, handling of the even flowers, that may result in the dermatitis conditions, allergic dermatitis. Coming to other clinical features, there will be dilatation of cutaneous blood vessels resulting in a flushed face, that the face appears more reddish in color, and there will be difficulty in urination with the pain and all, causing dysuria, bladder distension. That is why it is called full as a flask. Drunken gait or a staggering type of gait due to ataxia seen in the patient. The staggering gait means a broad unsteady gait, broad-based unsteady gait, similar to the person walking in a state of drunkenness. There will be hyperreflexia with increased reflexes like Babinski skin and all, and convulsions will be there. Delirium. A typical muttering type of delirium is seen in case of the Datura poisoning. Muttering delirium means a patient talking in a low pitched, muffled voice and talking illegible or not understandable words, talking irrelevantly also. There will be pill rolling movements like this, and carphology or vacillation, that is due to confusion. He may be picking the imaginary threads from the clothes or bedsheet, or threading an imaginary needle, or trying to grab some imaginary objects like that, all due to confusion, agitation. Then there will be delusions, dreadful auditory and visual hallucinations will be there. That is why it is called as mad as a wet hand, these features. These are all due to central effects. This is a mad as a wet hand mnemonic. Drowsiness eventually occurs. Then death may result due to respiratory depression. That is a depression or respiration, usually due to central respiratory central depression preceded by tachycardia, cardiac arrhythmias, and a coma preceding the death. So the clinical features of Datura resemble drunkenness and a heat stroke. Sometimes examiner may ask you any other poison resemble drunkenness-like features because of the staggering gait, dilated pupil, and other CNS manifestations. It may resemble that of this drunkenness. So since the treatment is different between these two, we have to diagnose properly whether it is Datura poisoning or due to heat stroke or due to alcohol poisoning. So these are the uh, to remember these toxidrome features, okay, which have been depicted in the form of pictures. Coming to fatter dose, 50 to 100 seeds is sufficient. So from one fruit we can kill some even 5% adult persons also. 30 milligram of scopolamine as an alkali, 100 milligram of atropine or hyoscyanin. These are all as per alkalis. That is the dose. Fatal period is 24 hours. Kindly pause the video and try to answer this MCQ. All are true about Datura poisoning except dilated pupil, mydriasis, decreased temperature, dysarthria, dysphagia. So the answer is obviously B here. There will be the increase of temperature, hypothermia will be there as we have seen. Person was brought to this hospital by police from the railway platform. He is talking irrelevant. He is having dry mouth with hard skin, dilated pupils, staggering gait, slurred speech. So most probable diagnosis is here talking irrelevant, dry mouth, hard skin, dilated pupils, staggering gait, slurred speech all occur in case of alcohol poisoning also. Here the clue for the MCQ is the railway platform, which gives the answer as the Datura poisoning instead of alcohol intoxication. So answer is D. D. Fatal dose of Datura seeds is, as you have seen, around 50 to 100 seeds. Diagnosis usually established with a GCMS, that is gas chromatography, mass spectrometry. The atropine in blood, even in traces, can be detected by this method. Mediatrics test, that is a bedside test, instill the patient's urine or the solution of suspected seeds in water and instill 1 or 2 drops in the cat or rabbit's eye. After a few minutes there will be, or surely you have to check after 30 minutes, there will be a bilateral dilatation of pupils in the rabbit or cat's eye. That indicates it is a Datura or this sample. Pilocarpine test, similarly, instill pilocarpine in the eyes of the patient as the pupils are dilated. After instilling pilocarpine, if it is due to other causes, that may cause constriction of pupil, whereas in case of Datura poisoning, after instilling 2 or 3 drops of 1% pilocarpine, there won't be any constriction within 30 minutes. So that means it is a dilatation is due to Datura toxicity. Blood will show neutrophil leukocytosis also. This is the pilocarpine 1% of this ophthalmic solution. Uttering delirium, carphalgia, pill rolling movement, tachycardia are seen in poisoning by. Here tachycardia may be seen in ethanol poisoning also, but tachycardia is in cocaine poisoning also. But here muttering delirium and carphalgia are seen typically in case of Datura poisoning. Coming to treatment part, patient has to be kept in quiet and dark environment as he is suffering from photophobia and delirium. Gastric lavage can be done with weak solution of tannic acid followed by activated charcoal instillation, which absorbs the leftover fluid and poison after the gastric lavage is done. Generally, gastric lavage is beneficial within 1 hour of ingested poisons. Here, these belladonna alkaloids cause a decrease in the gastric motility, so the seeds may be present even up to 36 hours post ingestion. So, up to 36 hours, gastric lavage is said to be beneficial. Enterotracheal intubation and artificial respiration of the patient is often in case of respiratory distress, or anytime he may go for respiratory distress, we have to better connect with the ventilator. Catheterize the bladder to relieve the dysuria and the bladder distension, that is important. So after these stabilization procedures, we have to go for giving the specific treatment with the antidote, which is the physostigmine, which is the physiological or pharmacological antidote, which means those drugs produce the contradictory effects than that of the poison, thereby counteracting the effects of poison. Poison is causing a bradycardia. This physiological antidote will produce tachycardia, right? Like that. So physostigmine is the parasympatomimetic or reversible acetylcholinesterase inhibitor that is the ideal drug that has to be given in a dose of 0.02 milligram per kilogram body weight, slow IV over 5 minutes, and if necessary can be repeated after 1 hour. Being a tertiary amine, it crosses the blood-brain barrier and reverses the central effects. So it helps to combat hyperthermia, delirium, convulsions, hypertension, arrhythmias, and coma. But this is a dangerous drug with the side effects like convulsions, respiratory depression, bradyarrhythmias, asystole, etc. So continuous cardiac monitoring is required when you are giving this physostigmine IV. Whereas neostigmine, pyridostigmine, pilocarpine, these drugs are quaternary amines. They cannot cross the blood-brain barrier, so they cannot reverse the major central effects. So physostigmine, if available, that should be given instead of this neostigmine or pyridostigmine, etc. Diciform slow IV has to be given over 3 minutes because if we give fast IV, that we itself may precipitate the respiratory arrest as the patient is already in respiratory depression. Or parenteral or oral haloperidol also will be beneficial. This is useful to relax the patient who is suffering from agitation as well as to relieve the delirium effects like delusions, hallucinations, agitations and all. Diciform, again, useful for control of seizures. Diciform, slow IV or loriciform. In case of children, midazolam is more useful, or pentobarbital sodium. If these diciform are not effective, can be tried for control of convulsions. If there is status epilepticus, we can try thiopenton sodium also. Tepid sponging or ice bath to control the hyperthermia. Right? So external and internal cooling measures are helpful to relieve the hyperthermia because this hyperthermia, the temperature is more than 40 degrees Celsius and all, usually not responding for routine these drugs like paracetamol, right? This is the physostigmine injection, which is the main antidote. You should not forget here. This picture shows multiple uh, toxic drone features of anticholinergic Datura toxicity. Pause the video and you can try to attempt this MCQ. What is the for this belladonna poisoning? Neostigmine, physostigmine, magnesium, atropine. So physostigmine is given now. You have to go for physostigmine only, as is the tertiary amine. Coming to PM findings, as patient often dies due to respiratory failure, due to central respiratory depression and all, there will be signs of asphyxia will be there with the congestion of all the organs, cyanosis in the extremities, then petechial hemorrhages in the mucous membrane and visceral pericardium, etc. Visceral pleura and pericardium, all these. There may be pulmonary edema also due to asphyxia. Then seeds and fragments may be found in the stomach. Okay, as you are seeing in this picture, they are embedded in the gastric mucosa. As these alkalis delay the gastric emptying, the gastric lavage is not done, it can be seen, right? Even in case of delayed this also. Coming to medical legal importance, Datura seeds may be mistaken for chili seeds and accidentally may be consumed, resulting in Datura toxicity. Therapeutic misadventure due to overuse of these folk medicines, which can be used as treatment for asthma or used as an aphrodisiac. As excess dose may cause accidental poisoning. Suicide common in case of rural areas as this plant is seen everywhere on the roadside. Homicide. In Tamil it is called Umathai. The Tura plant is called Umathai. Homicide is rare because of the bitter taste and all these dramatic onset of features which occur immediately. Abortifacient, this plant can be used, and aphrodisiac we already seen. All start with A, right? It can be remembered by accidental poisoning, abortifacient, aphrodisiac, etc. Sometimes accidental poisoning being used as a drug of abuse. This may result in for these hallucinations or hypnosis effect that overdose may cause accidental poisoning. This is the datura seed, this is the chili seed. right? They are have to be differentiated because these datura seeds are deadly poisonous. They are more darker and relatively slightly larger in size also. They are thicker. The surface is showing numerous depressions, whereas chili seeds they are smoother. They are more yellowish. It is more yellowish brown or brownish in color, but both are somehow kidney shaped only. So, in case of doubt, you have to make a longitudinal section of these seeds and look for the shape of this embryo. In case of Datura, the embryo is this is the hilum part of the seed that is curved outwards like this, like a capital D, it is curved outwards. Whereas in case of chili seeds, this embryo is curved inwards towards the hilum here, like the figure of C as in chili seeds, like C it is curved inwards, we can remember, right? So curved outwards or curved inwards, just to differentiate whether it is Datura seed or chili seed. So these are the table showing differences between Datura seeds and chili seeds. So it is kidney shaped with the convex border. There are two spikes will be there, right? Whereas the convex border is smooth here, it is more rounded, and surface is showing depressions and is smoother in case of chili seeds. And these chili seeds are having both a bitter taste, sorry, this pungent taste and pungent odor, whereas the datura seeds are bitter in taste but they are odorless. So this curved inwards like C in case of or figure of 6 in case of chili seeds, curved outwards at hilum in case of the datura seeds like a capital D letter. All of the following are features of the Datura seed except kidney shape, yes. Bitter taste, yeah, they are bitter. Whereas the pungent taste in case of chili seeds. Surface has numerous small depressions, that is correct. Along to section embryo seed curved inwards at here. That is the answer here. Answer is D here. Embryo is curved outwards. It is curved inwards in case of chili seeds. Other medically related points is it is used as stupefaction drug, as we already discussed, being mixed with the food or drink or tobacco and being given to the fellow passengers by the strangers, which causes stupefaction with the delirium and confusion, and finally go for a semi-conscious state, which facilitate the robbery or rape or kidnapping. So it is called a road or a railroad poison or railway poison, etc. Often these cornfields are infested with the datura plant, so those people, sorry for the spelling error for plant here, right? Those people who are harvesting this corn, they often be exposed to dust from these datura pollens from the datura plant, so their eyes may be showing persistent dilatation of pupils. So the doctor should not get confused with these. Sometimes the doctors may go for thinking that it is due to intracranial lesions or any hemorrhage inside resulting in dilatation of pupil. They go for lumbar puncture or CSF analysis or CT or MRI like that. So you have to ask the occupation whether he is a corn picker or not. So as these datura plant are commonly growing along with the corn, this datura test may cause this persistent dilatation of pupil, which is called a corn pickers pupil. Some people grow this datura plant as a hobby in their gardens. Again, they also, due to exposure, may coming with complaints of bilateral dilatation of pupil, sometimes unilateral dilatation of pupil also. So that is called a gardener's eye, gardener's mitiasis. If any person due to delirium secondary to this datura toxicity commit any crime, if the datura is being given without his knowledge, as we have seen, like a passenger being poisoned with after taking the food, and due to delirium if they commit any crime like assaulting others or murdering others like that, as a result of confusion, they are not held responsible. Or if the datura poison or drug is given forcefully against their will, after taking that under force or compulsion they commit any crime, they are also not criminally responsible. But if the person voluntarily abuse the alkyls as a form of aphrodisiac or overuse of these folk medicines resulting in a delirium, then patient may be criminally responsible. Here you can see this Datura plant growing along with the corn, resulting in the conpicus people. This is the unilateral mydriasis on his right eye, who is growing Datura in his garden as a hobby, resulting in the gardener's eye or gardener's mydriasis. This is also the child who is playing in the garden and handling these flowers, exposed to these Datura alkalies, resulting in the unilateral dilatation of his right eye. So the history and occupation is important. Conspicuous people is a feature of, obviously the choice is the Datura Poisoning. D is the answer. So these are the references. I thank these authors of these books. Thanks for watching. Hope you understood this important Datura toxicity, where several Ds are important, right? From about onwards, you can remember us. For brain, it is a delirium, muttering delirium, delusions, dreadful hallucinations, drowsiness. Coming to eyes, diplopia, dilated pupil, right? Coming to mouth, uh, dryness of mouth, dysarthria, dysphagia. Then further down you can come to skin and all, you can see this dry hard skin, dermatitis. Coming further down, distended bladder. Then coming to foot, dilate this drunken gait or staggering gait, which is a CNS manifestation of course. And finally, death due to respiratory failure. These are some Ds you can remember also. Another important fact as per exam is, instead of Datura poisoning, it can be asked indirectly as road poison or railway poison also as a 5 mark question. So you have to mention about Datura poisoning there. So with this, we come to the end of this presentation. Thanks for watching. We will see with another presentation in the next video. Bye.